every day we wake up and we have choices about what we can do. What do we want to eat? What do we want to wear? Should you post that picture on Facebook, or should you just let that one stay in your phone? There's a lot of choices out there. But does that choice extend to your health care? For some it does, for others it doesn't. So that's kind of what I want to talk to you about today. To talk about this, though, I have to go way back, because the theme was permission. And for me, when they asked, they said, well, we'd like you to talk about permission to use naturopathic medicine. Well, geez, I hadn't thought about that in years. So when I was growing up, my cousin actually had childhood leukemia. And we were, like other families that deal with cancer, we were in remission. We were in relapse. We went on this merry-go-round with cancer, round and round. Those words, relapse and remission, either lifted our spirits or gutted our souls. And through all this, when I was a young girl, I thought, well, doesn't everybody have a cousin with cancer? Well, turns out they didn't. So when I was little, I would go to my aunt and I'd say, she's shaking on the floor again. My vocabulary didn't involve seizure, but it involved knowing what to do when my cousin was having a medical emergency. So my particular lens of childhood was much different. I grew up with cancer. I grew up with it actually 3 times over in my family. And so it was a unique experience for me. As I aged, I was thinking about, what do I want to do with my life? And my mother asked me, that quintessential question, well, what do you want to do with your life? And the first thing that came to me was that I wanted to change the face of medicine. I didn't know what that meant then. I still don't know now, actually. But as I go through life, things become a little bit more clearer and clearer. So I got a college soccer scholarship. I went down and played soccer in Illinois. And I was with people from all over the world, actually. And we were talking about our ideals, like good college freshmen do. And here I was, and I brought it up again. I said, I want to change the face of medicine, and I want to have other families have a different experience than we did. One of my suite mates looked at me and she goes, like what? Naturopathic medicine? And in the Matrix, when the whole world just like slows and everything's so precise, that moment literally gripped me right in my core. And I thought, what is this? So this is year 2000. The internet, for me, was relatively new. We'd just basically gotten an Ethernet cable at our college dorm, big deal. And so I'm scouring the internet, and I'm looking about this field of medicine that I had no relationship with. And what I did then is I found some great websites. Here's the tuition, here's the accreditation by the board of, somebody federally. And, this is what the coursework might look like. And then I stumbled upon the tenets or philosophies of naturopathic medicine. So there's 6 of them, and they're specific. And the first one shares its home, basically, with medicine. It's just basically, first, do no harm. And then the next one is the healing power of nature. And discover and treat the cause. We really want to know why something is happening. We want to treat the whole person. We want to have the physician as a teacher. And prevention is always the best cure. Like, doesn't that sound awesome? Like, if you went into every consult you've ever had with a doctor and those were the ideals that they were living by, medicine would be a lot different. And it sounded so cutting edge to me, and I was really excited. But really, this medicine's been around since the 18th, 19th century, and it's modernized itself as we've moved along in history. So I set my course to graduate, and I'm going to do this, I'm going to do this. Okay, now I apply, and I get accepted into the program, and I go through 4 years of school. I get accepted into a residency program. Okay, I'm done with that. And then I get the opportunity to come back here to my home state of North Dakota, because we had just passed the licensure laws for naturopathic medicine in 2011. And that was a really big deal because we were the first state to do it on the first try. And I it went through pretty quickly, so it was a great success for the few NDs that were working here. So I've basically been here in practice since about 2013, and I'm actually in a collaborative practice with Dr. Glenn Highland. He's a medical doctor, and I'm a doctor of naturopathic medicine. And he and I were talking about this. I was like, it's so strange to think about why I would need permission. I made this decision at 18. I'm 33. It was almost half my life ago. I don't know what to say. And so we started thinking about it, and one of the themes that came up was that, this conversation we would have with patients, and it basically goes something like this. Dr. Link, I haven't told my primary care provider, or I haven't told my oncologist, I haven't told my rheumatologist that I'm working with you. To me, it doesn't bother me, but it does bother the patient because they feel like they're somehow harming that relationship that they've built already with that provider, that they're being untruthful. And I don't want the patient to experience that. I don't want to be a medical adulterer. That's not what I came to do. And I want the patient to feel comfortable. So the first thing I say is, well, you should tell them. You should tell everybody about me, and you should tell, isn't that great? Tell everybody about me. And then you should also tell me who else you're working with. Are you working with a life coach, or are you doing some extra yoga, or are you seeing somebody for this, maybe doing something with mental health? That's great. I want to know who's involved in your care team. And actually, most providers want to know that. And what we do then, basically, when people come in, is it's very basic. See the patient, we listen about their symptoms, we'll do a physical exam, we maybe need to order blood work or imaging if necessary. So things that you're basically used to. But then comes the part that I would call the naturopathic part. I want to know a lot about you. What are your stressors? What is going on in your life? Do you have, marital problems? Does somebody near you have marital problems? Is there addiction in your family? And sometimes I call these secrets, and I really actually feel like a secret keeper for people because they're not used to being asked those intimate questions. And so what that does is it creates a nice relationship between the two of us because people get the opportunity then to acknowledge that, let it out in the open, and not carry that burden with themselves. So we do this a lot, and the response I usually get from people is that, wow, no one's ever asked me that before. And there's a really interesting study that was released by the CDC and Kaiser Permanente. It was a long study of 17,000 people. And they looked at if people had had a childhood trauma, and that could be, a parent that was abusive or emotionally neglectful, a death in the family, a divorce. So that gamut of trauma really ranged. Well, what they found from that study is basically that people who were exposed to some sort of trauma or traumas, as adults, they're more at risk for chronic disease. And so for me, that means a lot because I tend to see only adults. And we really have to go back into our histories and look at, how do I feel about that situation? And there are so many times where patients will say, no one's ever asked me, and I've kept this secret in my family, and they just breathe a sigh of relief. And it's important because we don't need to hang on to that. We need to acknowledge that it happened and move through it, but we don't need to hang on to that secret because basically they just kind of fester like open wounds for people a lot. So that brings me back to permission. And one of the other things that happens daily in our practice is that we have patients that basically kind of unload on us. And what I mean by that is that they have been hurt by another healthcare provider. And I don't mean physically, but they'll come in and they'll say, that person didn't listen to me, that person didn't believe me, they disqualified what I even said to them. And so a lot of times I'll have a conversation with the patients about, sometimes if we don't know, we maybe dismiss. And what I'd like providers to think about doing is having on a very authentic communication with their patients and just saying, I don't really know anything about that, or I haven't heard of that, or thank you for doing all that research. Maybe there's somebody out there that can help you, but I just don't know. Saying I don't know makes us more human. It deepens that connection between your patient and you. And it gives that patient more permission to come back and ask you about other things. Because the other thing that happens in our office is Dr. Google. Dr. Google is an interesting phenomenon because medicine has really changed, because now everyone around the world has access to high quality medical information. Mayo's got a site, Medscape's got a site, they exist. So patients are able to get more medical information than they ever have before. People didn't buy the Merck manual, which is a book this thick, just to have at home so they could thumb through it. You know, they're on the internet, they're checking up symptoms, they're looking at diagnosis. If a friend was diagnosed with something, they're going on the internet and they're reading about it. So we're much more educated. And also, our healthcare is actually more global because there's health experts on the internet, and they've got their blogs, and patients are going to forums and support groups, and they're educating themselves. And I think that leads to my last point about permission, is that patients aren't settling. They're giving themselves permission not to settle, which I think is very impressive. And they're being their own advocate for their health care. If they're not seeing symptom relief soon or quickly, they may move on, or they may turn to these outside resources. So the medical landscape has really changed and doesn't exactly exist within four walls anymore. The medical landscape has changed so much. If you ever read the New York Times, you'll see that there's a primary care physician shortage. Medical schools haven't kept pace with the patient population. We've got more medical doctors that are unhappy. There's more limitations with insurance. And now we've got these patient evaluation studies that hospitals are using, and it's showing that patients aren't happy either. And that's a bad combination when the patients aren't happy and the doctor's not happy. So what do we do about that? Well, that's where I think collaborative medicine comes in. I had a great conversation with Dr. Tello earlier, and we talked about a patient. It was a 5-minute, we call that a bedside or tableside consult, and it was great. He gave me some really good ideas about what to do with this cancer patient, and I was really struggling with her. So that type of interdisciplinary conversation is where we need to head. It can't be us against them. We've really got to embrace our care teams, and that's how we're going to move forward through this healthcare new landscape. So thank you and have a great day.